Hello everyone! Welcome back to PsychoNest. If you enjoy learning psychology in a simple and accurate way, don't forget to like this video, subscribe to the channel, and share it with others. Let's begin. Schizophrenia spectrum and other psychotic disorders today. We'll learn about schizophrenia, spectrum, and other psychotic disorders according to the DSM-5-TR. These disorders all involve some form of psychosis, such as delusions, hallucinations, or disorganized thinking. Let's look at each one. Many people think schizophrenia simply means hearing voices or having multiple personalities, but that's a myth. Schizophrenia is a complex mental disorder that affects the way a person thinks, perceives reality, expresses emotions, and behaves. According to the DSM-5-TR, schizophrenia symptoms are grouped into 5 major domains: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. Let's understand each one in detail. Delusions. Delusions are fixed false beliefs that a person continues to believe even when there is strong evidence proving them wrong. The person is completely convinced that the belief is true. Simply correcting them or showing evidence usually does not change their belief. Hallucinations. Hallucinations are perceptions without any external stimulus. The person experiences something that feels completely real, but no one else can perceive it. Hallucinations are different from imagination because the person truly experiences them. Disorganized speech. Speech reflects how organized a person's thinking is. When thinking becomes disorganized, speech also becomes disorganized. The person's conversation may become difficult or impossible to follow. Grossly disorganized or catatonic behavior. This symptom affects how a person behaves physically. Their actions may become unpredictable or unusual. Negative symptoms. Negative symptoms refer to the loss or reduction of normal abilities. These symptoms often affect daily life more than hallucinations or delusions. Positive versus negative symptoms. Students often find these terms confusing. The words positive and negative do not mean good or bad. Instead, they describe whether something has been added or taken away from normal functioning. Positive symptoms. Positive symptoms mean something has been added to the person's normal experience. These include delusions, hallucinations, disorganized speech, grossly disorganized behavior, catatonic behavior. Examples: hearing voices that aren't there, believing someone is spying on you, talking in a confused way, showing bizarre or unpredictable behavior. These experiences are extra symptoms that healthy individuals normally do not have. Negative symptoms. Negative symptoms mean something has been reduced, lost, or is missing. These include reduced emotional expression, lack of motivation, reduced speech, inability to enjoy activities, social withdrawal. Examples: not showing emotions, not wanting to leave bed, speaking only 1 or 2 words, losing interest in hobbies, avoiding family and friends. These are losses of normal functioning, not additional experiences. Easy memory trick. Think of it like mathematics. Positive plus means something is added. Hallucinations are added. Delusions are added. Disorganized speech is added. Bizarre behavior is added. Negative means something is missing. Emotion is reduced. Motivation is reduced. Speech is reduced. Pleasure is reduced. Social interaction is reduced. The first disorder is schizotypal personality disorder. People with this disorder have odd beliefs, unusual perceptions, eccentric behavior, and significant social anxiety. However, unlike schizophrenia, they generally remain in touch with reality and do not experience persistent hallucinations or fixed delusions. Next is delusional disorder. The defining feature is one or more persistent delusions lasting at least 1 month. Hallucinations are absent or only mildly related to the delusion. Functioning is usually much better preserved than in schizophrenia. The next disorder is brief psychotic disorder. This involves a sudden onset of psychotic symptoms such as delusions, hallucinations, or disorganized speech. The episode lasts at least 1 day but less than 1 month, after which the person returns to their previous level of functioning. It often follows severe stress or trauma. Next is schizophreniform disorder. The symptoms are almost identical to schizophrenia, but the duration is shorter. The illness lasts at least 1 month, but less than 6 months. Some individuals recover completely, while others later develop schizophrenia. Now let's discuss schizophrenia itself. According to the DSM-5-TR, A person must have at least 2 of the 5 major psychotic symptoms, and at least one of those symptoms must be delusions, hallucinations, or disorganized speech. The active symptoms must be present for at least 1 month, while continuous signs of the illness must last at least 6 months. There must also be a significant decline in important areas of functioning, such as work, education, relationships, or self-care. The next disorder is schizoaffective disorder. This condition combines schizophrenia with a major mood disorder, either major depressive disorder or bipolar I disorder. One of the most important diagnostic criteria is that the person experiences at least 2 weeks of hallucinations or delusions without any mood episode. In addition, mood episodes are present for the majority of the illness. Next is substance or medication-induced psychotic disorder. Here, psychotic symptoms occur because of substances such as cannabis, cocaine, amphetamines, alcohol, or certain medications. Treatment focuses on stopping or treating the substance responsible. Another disorder is psychotic disorder due to another medical condition. In this case, the psychosis is caused by a medical illness, such as a brain tumor, epilepsy, Parkinson's disease, Alzheimer's disease, stroke, or thyroid disorders. Treating the underlying medical condition is the primary goal. Catatonia mainly affects movement and behavior. A person may become very still, stop speaking, hold unusual body positions, resist instructions, or repeat another person's words or actions. Catatonia can occur with schizophrenia, mood disorders, or medical conditions. A diagnosis requires at least 3 catatonic symptoms, other specified schizophrenia spectrum, and other psychotic disorder. This diagnosis is used when a person has psychotic symptoms but does not fully meet the criteria for a specific disorder. The clinician explains why the criteria are not met. Examples include persistent auditory hallucinations, short-duration delusions, or attenuated psychosis syndrome, unspecified schizophrenia spectrum, and other psychotic disorder. Finally, unspecified schizophrenia spectrum and other psychotic disorder is used when psychotic symptoms are present, but there is not enough information to make a more specific diagnosis. The clinician does not specify the reason, and it is commonly used in emergency or early assessment settings. Now that we've covered each disorder individually, let's compare them side by side. Looking at them together makes the differences much easier to remember. Schizotypal personality disorder is a personality disorder, not schizophrenia. People have odd beliefs, unusual behavior, and difficulty forming close relationships, but they do not have persistent psychosis. Delusional disorder is characterized by 1 or more fixed, false beliefs, lasting at least 1 month. Apart from the delusions, daily functioning is usually relatively normal. Brief psychotic disorder involves a sudden onset of psychotic symptoms such as delusions, hallucinations, or disorganized speech. It lasts from 1 day to less than 1 month, with full recovery expected. Schizophreniform disorder has the same symptoms as schizophrenia, but lasts between 1 and 6 months. Some people recover completely, while others later develop schizophrenia. Schizophrenia lasts at least 6 months, including 1 month of active psychotic symptoms, and significantly affects work, relationships, education, or self-care. Schizoaffective disorder combines schizophrenia symptoms with major depression or bipolar disorder. There must also be at least 2 weeks of psychotic symptoms without mood symptoms. Substance or medication-induced psychotic disorder is caused by drugs, alcohol, medications, or withdrawal, and symptoms often improve after the substance is removed. Psychotic disorder due to another medical condition occurs when psychosis is directly caused by illnesses such as epilepsy, stroke, or Parkinson's disease. Catatonia mainly affects movement and behavior, causing symptoms like immobility, mutism, unusual postures, or repetitive movements. It can occur with schizophrenia, mood disorders, or medical conditions. Finally, other specified and unspecified schizophrenia, spectrum, and other psychotic disorders are used when psychotic symptoms are present, but the full criteria for a specific diagnosis are not met. The easiest way to remember them is by their unique features. Delusional disorder focuses on persistent delusions. Brief psychotic disorder is short-lasting. Schizophreniform lasts 1 to 6 months. Schizophrenia lasts 6 months or more. Schizoaffective combines psychosis with mood symptoms, and the remaining disorders are identified by their specific cause or presentation. That's all for today's overview of schizophrenia spectrum and other psychotic disorders. I hope this made these diagnoses easier to understand. If you found this helpful, Like this video, subscribe to PsychoNest, and share it with others. Thanks for watching, and I'll see you in the next video.